Heading back in for another day at Stanford Hospital for some therapy work with Rita. We've been doing therapy work for about 6 years. We're going on our 7th year. Okay, let's get you in back. Come. Rita, let's go. Up. Before every visit, the dogs have to go through a complete grooming to make sure that they are as antiseptic and clean as possible for all of the patient visits. Okay, it's your paw. Other paw. There you go. Okay, let's go.
We definitely see our program as part of the healing process in a variety of ways, be it on the physical side or be it on the emotional or mental side. We really see ourselves as a part of the healthcare team and a part of what the uniqueness of what Stanford brings to our patients.
Surest thing for getting the dog to do her potty break before we head in is mother of all fire hydrants here in front of the hospital. Good dog, Rita.
If you ever noticed any of our teams walking down the hall, going towards a unit to see a patient, they are stopped left and right by visitors, by employees, by random people walking around, very happy to see a dog in a hospital.
It's a genuine therapy. It's a heart-to-heart, immediate connection. There's nothing in the way. It's just instant.
There you go, good girl.
Okay,
how funny, how pretty.
We're okay. Rita likes that body contact, so let me know if there's any pressure too much. We'll just reposition her.
I'm fine.
What I've seen happen between patients and dogs when we bring the pet in to visit is it's quite enormous, actually. There's a lot that goes on.
So good girl.
Yeah.
Hi, Rita.
I'll say who I am. I'm Nan with PAWS at Stanford. What does that mean? I'll go like this, Pet Assisted Wellness at Stanford. Oh, I have a dog. That's how it'll start. There's an exchange that takes place immediately, as if the magic starts.
There's nothing like a dog. I don't like people. I like animals.
A lot easier to figure out for the most part.
It alleviates pain, it alleviates high stress, it alleviates anxiety, which are very common traits in a hospital. In this environment where people really don't want to be, no one ever says, hey, let's take a vacation to the hospital. We in guest services try our best to better the patient experience, both for the family and for our guests.
When I walk into a room with the pet, I have seen the patient's demeanor. I walked into a man's room and he was very disgruntled. I told him who I was and he goes, a dog? What do you mean, a dog? I said, well, you're here in the hospital and this dog is here for you today. Would you be willing? Would you give it a try? So then he sees the dog and he goes, oh, hi, little Poochie. Oh, come here. Come on, get up on the bed. He saw this softness come on his face, and then he started to cry. And he was a big man, kind of with the guard up and everything. Well, 2-3 days later, he was still in the hospital, and I saw him trucking down the hallway. He saw me, and he said, hey, I know you. You're the PAWS lady. Some people actually call me Mrs. PAWS. And he said, after that visit, I had hope again. And he said, I told my wife, and she said, I wish my wife could have come and given you a kiss, because she said, I've never seen him smile like that.
Good dog.